Good morning. I want to thank Senator Markey for the honor of being here with you today, for holding this event, and especially here at the Codman Square Health Center, founded on a dream to build the best urban community in America and recognizing that healthcare begins with alleviating sickness. So I want to thank all of you for the work you do here at Codman Square toward that end. When I was appointed the director of the Centers for Disease Control and Prevention in January of 2021, the headline said that I was a political outsider who lacked government experience. They were right. I spent 25 years at the bedside caring for patients, and I never once asked one of them how they voted. And I conducted research that resulted in policy change to increase access to HIV treatments. Maybe my then paucity of government experience was my Achilles heel. I will call it my North Star. The CDC was founded in 1946 and has been chronically underfunded to accomplish the tasks for which it's responsible. By its 74th year, the CDC had never tackled a public health disaster like the COVID-19 pandemic, affecting 340 million Americans all at once. With 4,000 people dying every single day in the United States from COVID-19, I took the directorship of a weary agency. Decision requests reached my desk when there were only bad answers to choose from and sparse data to guide them. I left the agency after my 2.5-year tenure, having assisted the effort of putting nearly 700 million COVID-19 vaccine doses into arms, an effort that has been estimated to have saved 3.2 million lives. There is a clear nexus between the narrative around the perception of CDC's performance and the treacherous place we now find ourselves. The shortcomings of CDC, both real and fictional, during the height of the COVID-19 pandemic are being used as a pretext to dismantle both the agency and the programs that ensure Americans have access to life-saving vaccines. HHS leadership is inching towards a complete vaccine takedown, incrementally chiseling away at our previously trusted systems, leaving behind a shaky, fragmented vaccine facade that is increasingly obscure and untenable and that has already limited vaccine access. Numerous steps have been taken. I will outline them for you. Restricting vaccine access by age and risk factors. I'm so grateful to Governor Healy and Commissioner Goldstein for the actions yesterday so that this is less of a challenge here in the great state of Massachusetts. Withdrawal of $500 million in BARDA funding for mRNA research. Dismissal of 17 expert members of the Advisory Committee on Immunization Practices and replacing them with a panel of vaccine skeptics, and firing CDC Director Susan Monterez for refusing wholesale acceptance of the new panel's recommendations. Sowing doubt and confusion into who should get vaccines. For example, a posting from HHS on X noted that pregnant women would no longer be eligible for a COVID-19 vaccine, when their very own FDA commissioner had just authored a piece in the New England Journal of Medicine, which clearly stated that pregnant women are on the list of underlying medical conditions that, quote, increase a person's risk of severe COVID-19. Instilling fear in those that follow the advice of the American Academy of Pediatrics, who recently recommended vaccination of babies 6 months to 2 years old. Another HHS post incorrectly noted that recommendations that diverge from CDC's official list are not shielded from liability. What's less visible are the plans to reform the Vaccine Injury Compensation Program. This program, created in 1986, is a pillar of vaccine policy that compensates the rare but serious cases of true vaccine injury while protecting vaccine makers and healthcare providers from liability. Without it, manufacturers have stopped producing vaccine, and they very well could again. Equally at risk is our Vaccine for Children's program, created in 1993 to provide under and uninsured children free access to the full pediatric vaccine schedule covering 19 diseases. Credited with preventing 472 million illnesses and saving $2.2 trillion, the Vaccine for Children's program now faces review by the newly formed ACIP, who are tasked to scrutinize that schedule and who have a clear anti-vaccine bias. Since the VFC, the Vaccine for Children's program, supplies vaccines for half of America's children, the stakes could not be higher. While I was at CDC and after my departure, I spoke frequently of our country's frail public health infrastructure and about the state of our preparedness for the next public health threat or the next pandemic. I reminisce about those now quaint days when lack of support for public health was our biggest challenge. Today, I'm most saddened by the lives that will be lost, those preventable deaths because of the erosion of our vaccine infrastructure that had previously been designed to foster truth, transparency, and safety. In today's divided America, there's actually one consensus that remains. 92% of parents still vaccinate their children. Surely we can all agree we don't want our children to die. There's an old saying, vaccines don't save lives, vaccinations do. Unless action is taken, and fast, you may be lured into thinking that our vaccines are here, but vaccinations themselves may no longer be within reach. Thank you.